You'll cut it off up there. Yes, sir. Well, thank y'all for coming tonight. We'll get through this fairly quick so we can get to your questions. I know y'all have more questions than to make everything more clear, but we just want to give as much information out about this as we can. To start out with, this is 2022 review, just kind of bring you up to speed. We responded to 3,800 calls, a little over 3,800 calls last year, which was a little bit down from the year before. But the year before, we were the city of Irondale lost all their ambulance service out there, so we were helping them out some. So our volume was up a little bit more that year, trying to help them out. It was down, but the one thing we did see last year was an increase of 452 calls inside the district. That's the largest increase of calls in the district we've had since I've been here, the 5 years I've been here. 2,433 emergency medical calls. That's 73% of what we do is run EMS. All over the district, we have 4 fire stations covering the district, 3 here. We have one out in Rex Lake, Rex Lake Road. That's a contract area for us. They contract with us to provide services out there, but that truck still services the whole community that we serve. But that's what we do is 73% of the time is emergency medical calls. Last year we responded to 32 cardiac arrests across the district, and 16 times we were able to restore heartbeats to those people. And we'll talk more of the effect on that. And then if we look at just our community here, is that 58% of the people that we do go to with strokes, heart attacks, the STEMI is a heart attack, or over those kind of calls, is 58% of those people are over age 55. So this is our mission and vision statement. The big thing here I want to focus on, what's in red, is one of our missions is to reduce risk reduction, and to have an efficient and effective response force. What that means is to have enough people to respond, enough units, and enough personnel to respond to all kinds of emergencies in our district. And right now, we're failing at this. We're failing at this. And we do much more. You saw we run fires, we run EMS calls, but we do a lot more. We respond to a lot of calls in this district just to help people get up off the floor that's fallen. Something we do too that a lot of people don't see is when a storm comes through, that we're out clearing roads. Our guys are out with chainsaws clearing the roads. Why do we do that? Because it's going to take a while for the county to get here to do it, number one. But number two, if the roads are blocked, we can't get to you. So we go out and clear roads during those storms. Do we do it perfectly? No, but we get it cleared enough that we can respond. So that's a lot more things that we're out doing in the community besides running the fires and that kind of thing. Our goals tonight and the goals of what we're trying to do are these 3 major things that we're trying to accomplish. One is to retain firefighters with competitive pay. I'll go more into that. Provide the appropriate staffing levels to meet the needs of the community. We'll get deeper into that to kind of explain more about it. And to restore the previous ambulance service. I'll talk more about that. But this whole thing we're talking about, this is our 3 primary goals we're trying to accomplish. Last year, give a little bit of background, we pushed our budget to the edge last year. And we were able, in January of last year, we were able to staff the fire truck at the Narrows station. Prior to that, January of last year, the fire truck in the Narrows did not have staffing on it. It was only staffed if the ambulance was there. If the ambulance was gone, there was no staffing there. We do a lot of data research. We keep up with what's going on in the district. Through that model, we found out the Narrows was one of our busiest areas in the district. And we had over a 7-minute response time to a district where a fire station sits. And we felt that was unacceptable. So we staffed the fire truck there last January. we reduced the response time in that area by 4 minutes, just with that one event. On average, they're making 63 calls a month out of that station. So it's become a very impactful area for us. Also last year, we were able to raise staffing levels. We got daily staffing up to 16 firefighters a day. That was pretty much 3 firefighters on every fire truck and staffing 3 ambulances in the district. That's where we were. With that, we had an ISO grading last July. We're hoping to have those results back here pretty soon. We think that with that staffing level, we've reached a Class 1 rating, which is, if it comes through, then that's the lowest possible insurance cost that you can have. We're still waiting on that to come back, and hopefully we'll have that in the next couple months. The 2021 vote, it failed during that time, but the needs that came out that we addressed in those are still here. They're still here, but they're even more critical than what they were. Something that's happened to us, Mr. Sarver mentioned the American Rescue Plan Act that came out, I guess right after COVID. All the municipalities and counties got funding from that. Just an example, I think somebody brought it up today, that the city of Birmingham got $141 million out of that. Of course, they're a large municipality, but everybody got them. But the thing we saw happening, they changed the rules on that money last March, that you could use that money for employee retention. And what we started seeing happening is the fire departments all over the state of Alabama, really across the country, started raising pay on all their firefighters. We were already behind at $28,000 a year for our firefighters. We used to have a resident program where we hired pretty much kids just right out of high school, gave them a place to live, trained them, and they would work to pay for their room in the fire station. And that program started falling away. We couldn't get applicants to come into the program. And a big difference for us is actual monetary pay for those guys was about $6,000 a year is what they got for working for us. When that program started fading, we couldn't get people to come into the program. We had to start hiring full-time firefighters, and that's where the $28,000 came in. That's about all we could do with our budget. Paramedic pay and all the other ranks we have, our lieutenants, captains, shift commanders, we call them battalion chiefs, their pay starts falling behind also across the area. The results of that was, since February of 2022, we had a 38% turnover rate in our department of people leaving. We were fortunate of being able to hire some people to replace those positions, but we would hire somebody and the next day somebody would leave and go somewhere for more pay. What that did to us too was the increased cost of hiring people. So every time we hired somebody, if they were not already trained, we had to send them to training. And so that's sending them to Tuscaloosa for training, and that's giving hotel rooms for 4 months, paying their meals and paying their salaries. Plus we have to buy them protective gear. All those things come in as an increased cost for us to continually having to do that. Costs causing decrease in staffing levels, we started seeing going from 3 firefighters on a truck on a regular, pretty much every day, to dropping to 2. We just started seeing that happening. Some things that we have done that forced us into for this current budget year, the fiscal year 23 that we are in, started in October, we had to cut 12 positions. So that was the big thing we had to do. We could find no other way. We actually started the budget year in a deficit this year. So there was no way to combat trying to get money up for our firefighters and to fix the deficit in the budget. So we had to cut 12 positions. Once we did that, we had to close down the ambulance at the Highway 280 station. So that was the results of this deficit we were getting into. Staffing on our fire trucks went from 3 to 2, pretty much across the board. That we only have 2 firefighters on a truck now. We were able to raise the pay for our firefighter EMTs. We got them up to $39,000 a year. We raised the paramedic pay up about $6,000 from where they were. We were able to do that little bit. But for our officers, lieutenants and captains who are still riding the fire truck with everybody else, we were not able to do anything with those guys. The 280 station is in bad need of repair, bad need. The last vote, we had the opportunity to build a new station. That didn't happen, but that station still needs major repairs done to it. So that's all delayed. We've had to put that off. We're trying to do some little bitty things right now that we can within our budget, but that's been put on hold. One thing we did do is we had a 2017 ladder truck. We sold it and bought a used truck from out of Ohio. And so what that do for us financially, it freed up a little over $100,000 a year in our budget, because all of our fleet is that we have loans out on those fleet. That's debt we have. So we freed up about $108,000, $110,000 in our budget, but we also eliminated right at $500,000 of debt by doing this. The issue with buying a used truck, it'll help us. It'll get us through a period of time, but the lifespan of a ladder truck is about 20 years. So we're already at 20 years on this truck right here. What happens when trucks get 20 years old? Well, maintenance becomes a big issue. A lot of times you can't find parts to fix the truck. There's a lot of issues that go with that when we buy a used truck. But that's something we have done to try to get through it. The impact here, lower staffing levels. When we dropped to 2 people on a fire truck, the crew is 30% less effective than a 3-man crew. And that comes from a study that NIST, National Institute of Science and Technology, they did several years ago to put that together. What's happening in our homes is that the way homes are built now is a fire doubles in size every 4 minutes. And it takes a lot. It takes a lot to get that accomplished. One thing we have in this community is we have a thing called NFPA standards out there. They kind of set criteria for fire departments out there, and the criteria for, say, a residential structure fire is 16 firefighters on the scene of a call. That is based on a single-story residential structure, about 2,000 square feet. This community around here, we're averaging about 3,500 square feet on houses and going up to 3 stories. So that's really impacted us. The effective response force has been reduced. What an effective response force is, we look at each type of call we run on, and we determine how many personnel it takes to do that call and to efficiently mitigate that incident, take care of it. So we have determined on a structure fire, it's about 16 people to mitigate that fire. It takes about 16 firefighters to do it. Right now, we're at 11. We have 11 on duty today. We're going to call mutual aid. We're going to have mutual aid come in from Hoover, from Chelsea, North Shelby, Birmingham, these other departments. But the whole part of it is we do the same thing for them too. We get reciprocal services when we provide that. A cardiac arrest. If somebody goes into cardiac arrest, it takes about 6 people to manage that incident efficiently. And if you happen to see that we're operating one of those incidents, a big question that comes up is, why are you not taking the person to the hospital? It's because we have found through studies that it's better for the patient for us to stay put and work on that patient in where they lay for at least 15 minutes before we make a determination. It takes time, takes personnel. Right now, we need 6. We're sending 4 to that call. For a motor vehicle accident, we were sending 7 people to those. We're sending 5 now, so it's dropped. Something else happened now, like for a cardiac arrest, we're having to send 2 fire trucks to that call, plus an ambulance to try to get the right number of personnel there. What's that do to the rest of the community? We're taking another truck out away from the community to respond. Big thing that's happened to us is with taking the ambulance out of the 280 station, we've seen a 50% increase in response times for ambulances in the community. Just here recently, in the last several days, at the end of last week, there was a cardiac arrest in the Shoal Creek community. The crew from the station here in Mount Laurel got there. The crew from Narrow Station responded also. They got there, they actually restored the heartbeat on that patient, but it took 22 minutes for an ambulance to get on the scene. So that's, to us, that's unacceptable. ISO rating, even if we say we get a class 1 rating this time, it's not going to hold. It's going to go backwards. And if our staffing levels are cut anymore, we're probably going to drop from a 1 to a class 3. Don't know that. It's a big math formula that I can't figure out how it works, but that's the impact it could have. If we were to drop to a class 3, then your insurance rates are going up. It's just the way it works. So, but we don't know for sure about that one yet. We hope that does not happen. What's ahead and beyond? These are some positive things for us, is that there's 8 developments coming into the community. 6 are here in the Dunn Valley community. About 486 homes we've projected, 188 apartment units coming in. That's going to push over 1,500 new residents coming into the district, which is great. The problem with us from a revenue standpoint is there's really no timeline for that to happen. But when these people start moving in, request for services is going to go up. There's going to be more commercial property coming in because to service the new residents coming in, more traffic on the roads. So that's going to put more demand on us. The revenue generated just from these developments still will not meet our budgetary needs. It's just not going to, there's not going to be enough money there from our projections we've done. Alternate funding sources that we've looked at. One thing to be aware of that a lot of people don't know is we do not have the revenue streams of a municipality. If you look at a municipality, they have sales taxes, property taxes, business license fees, gas taxes. You can go through all those things that a municipality has that we do not have. Our only source is the residents of this community and our ambulance transports. That's our only real source of revenue. The American Rescue Plan, we've kind of talked about that. We've met with the county trying to get assistance from them for some of the American Rescue Plan money. All that money's been earmarked. A lot of people probably seen on the news where it talks about the county is going to get into the EMS business. They're not getting into the EMS business. They are going to purchase some ambulances for the departments around the county that do provide transport services. Right now, the city of Alabaster and the city of Pelham are going into the ambulance business. So the county is, the first few trucks they're buying through the county are going to go to those 2 agencies to help them get started on ambulances. Why are they getting in the ambulance business? Because there are no ambulances in the county. You see an RPS truck running up and down, a private company, they're not providing services in the county. Very few places they are providing service to, and their response times are running around 25 to 40 minutes for an ambulance to get somewhere. So that's what's forcing the fire departments to get into the ambulance business. We made a request to the governor's office for some assistance. That didn't come through. We've applied for 2 federal grants for increasing staffing levels. Those both were turned down. We're actually right now writing a 3rd grant. We're in the process of writing it now. It's due to be turned in, I think, March 9th. And we've received a lot of tax-deductible donations have been received. This past year, we asked for a little money to help buy an ambulance, and we've gotten a lot of money from that. Still not there. I think we've received right around $90,000. We're thankful for that. It will go a long way to helping us get that new truck in. Some things that we are working on is that we're trying to get a meeting with the Shelby County delegation right now to start working on some amendments to our legislation that we have to work under. And we've actually reached out to some questions we had from the Attorney General about some changes we want to make, and they've given us direction which to go, so we're fixing to go in that direction, start working on that. I won't get too deep in that right now because we're probably 2 years out from getting anything done with that. Priority number one we want to talk about is firefighter pay, getting sustainable pay at all levels. We know that we're never going to get firefighter pay to what the city of Hoover is, or the city of Mountain Brook or Vestavia, those places. We know we're never going to get there, but we want to get competitive to the metro area. Retention, something that we want to try to do. This is a priority, but it's on the lower side. We want to try to do is try to fully fund health insurance for all of our employees, the family side. We do that for single coverage right now. We want to expand it to our family coverage for the simple thing of trying to retain employees to us. Long-term sustainability, capital funds needs over the next 5 years is we need to replace 2 ambulances. We have 1 on order right now. In fact, today we put our name on a truck, right? And the cost, I think when we put it out on the bills last year was $350,000. That price has now gone up to $378,000. Problem with that is an ambulance is about a 5-year lifespan on an ambulance. That's all it is. And I was talking to a vendor here today and said it's very easy with the equipment. When you start adding equipment to an ambulance, it's going to get up for over $400,000 for an ambulance. I think the last one we purchased would cost us $220,000. That's how much pricing has gone up. We need to plan on a fire truck replacement. That's not a high priority for us now. We have a new truck that's being delivered this week to us, but we ordered that 2 years ago for that truck. Ladder truck, we need to look at replacing a ladder truck down the road. And of course, our fire station issues. Just this week, we found out we've got to replace the roofs on the Narrow station. We've got to replace the roofs on the Mount Laurel station, and probably going to replace the AC units at the Narrow station. That's coming up that we got a plan for. One of our priorities is trying to eliminate debt, and that's one thing we did with selling the fire truck. We eliminated $500,000 in debt by doing that. So that was something we want to work for. And 2 is building reserve fund. As we sit right now, we don't have any reserve funds in our organization. We have money in the bank, but the way our billing cycle, and we'll get to this in a minute, is that we have to hold that money so we can make our payroll and everything from October to December while dues come in. But we'll get more into that in a second. So what we're asking for this year is to do an increase of $125 across the board to fire dues, and 23.5% we'll do that to all of our commercial properties and apartments. Why are they different? It's because they're calculated completely different, the commercial properties and everything. You get sprinkler systems. If they're sprinklered, if they're not sprinklered, all those things play into that, how we make that decision. With this funding, and I'll say this, all the funding we're asking for is earmarked for these projects. Number one thing, it will support the firefighter pay, getting it up, and retention. It will reestablish our staffing levels. If we get our staffing levels back up to where we need to be, and it will help get that ambulance back in service. That's the number one priority we have on this ballot. This right here. This is priority 1. Priority 2 is long-term sustainability. We want to change the billing cycle. Something that came out of the community meetings last couple years ago, was a lot of people didn't like paying their fire dues at Thanksgiving and Christmas. They didn't like doing that. That was a big thing we always got on that, was the time of year we were asking to do that. So we're going to change it this year. It will start on June 1. We'll start the billing cycle, and it will go to September 30th. Instead of October 1 to December 30th, it'll be June 1 to September 30th. It gives another month to pay, But the big thing with that is it takes you the money having out of the holidays, but it allows an additional month to pay it. But the big thing for us is we begin the year fully funded. Our budget will be funded to begin the year with. So the money that we do have extra in the bank, we now can start a reserve fund that'll help us when an AC unit goes out at a fire station. But it also, we can start looking at eliminating some of the debt we have to free up more funding for us. Another thing we're asking for is that we normally do a 5% increase every year. We're asking for 4 years after this is to add another 4% to that. That will help us get long-term sustainability. So that's something we're asking for. Capital project is what we're asking for. We saw our needs. What we're asking for this is, it's not $100 a year. We're just trying to set up, if we ever ask for it, that's the max we can ever ask for, is that amount of money. How we want to work with this, it's like if we need to buy the ambulance, $378,000. Is that we would take that cost and divide it up between all the properties in the district, which is 9,205, I think, properties and things. So we take that cost and divide it up between all the properties, and that's what we would ask for to help pay for that. What that does for us is it opens up the fact that we could go into municipal bonds to buy these trucks, because if we buy, especially a fire truck, if we prepay it up front, we can save about 15% on the cost of that truck. So if we can get a bond to pay that truck up front, we can save money, but then we can collect the money over time. And sometimes it may take a couple years to do this. But the big thing about this, we can only do one project at a time. If it takes us 4 years to accomplish that project, we can only do one. That's all we can do. We can't start another one until that one is over with. Ambulance billing change. Right now, the residents are not charged for ambulance service. We charge insurance companies, but the residents are not charged for that. That's a benefit. We're probably the only organization in the state, to my knowledge, that does this project. But what we're seeing happening is we got residents moving into the district that have no insurance. They don't have insurance. So that's 100% loss in revenue for us. Ambulance service is a failing financial venture. You can ask anybody in the ambulance service out there, it's a failing business. There's legislation out there in Washington right now being worked on to increase Medicare and Medicaid rates, reimbursement rates, but we don't know when that'll happen. But the other thing we're seeing over the years is that we assisted other fire departments. Like I said, we assisted Irondale time. We would assist other fire departments with helping them with transport services that would help bring revenue in to the district when we did that. Now, like Irondale, they've put 2 ambulances in service. They're not using us very often, so we're losing revenue on that. North Shelby, we would help them out. They've now put another ambulance in service, so that's decreased. City of Chelsea, we'd help them out. Now they have put another ambulance in service, so that's decreased. So this is decreasing. What this will help us do with this revenue, if you use the service, that's when it would come into play. But the big part of this is we have to replace all of our cardiac monitors. This is a continuous cycle. We carry 10 cardiac monitors in the system. They cost about $50,000 a piece just for the unit. That's not counting the supplies to go with it, the maintenance, all that goes with it. So this additional funding here will go straight to support the replacement program on these cardiac monitors. That's what that money will be used for. So going through this, just tell you that all this stuff is earmarked. It's not going to be fluff money sitting out there. This is earmarked funds to do specific things out there. Actions, like I said, we're going to change the billing cycle to June 1. So this is kind of what the ballot will look like. is we're going to have 4 questions on there that you can vote on individually. So it's just not one or all. You can vote on what you need. Our priority number 1 is to be the question 1 on there. That is priority number 1 for us, is that we've got to get our staffing levels up. We've got to get that ambulance back in service, and we've got to get pay for our firefighters. Number 2 is the adding the 4% to the 5 for the next 4 years, support of the capital fund, and then supporting the transport billing thing. Those are the 4 things that are going to happen. Now, Mr. Sarver made the statement about if none of this passes, the community chooses not to support any of these measures, what's going to happen? Well, our only next phase is more cuts. So the next cuts, the only real place to cut in our budget is we could probably sell another fire truck to cut some money out, but it really boils down to personnel cuts. If we wouldn't raise pay, we'd have to cut personnel again, and if that happens, then we got to look at probably closing down one of our fire stations. And so that's the effects that this would have if it doesn't pass. So that's a lot of information. I know y'all have a lot of questions out here. Chief Yancey or Grant, will y'all come up and get some mics, and we'll let y'all ask questions, and we'll try to answer them the best we can.